beginning, we're sort of gathering up the names of the first, second, and third place winners, and we'll let you know that in a few moments. But good afternoon and welcome to the 6th annual Islip Goes Purple event here in the town of Islip. I'd like to ask everyone to turn off their phones, which I should have done. I'd like to ask everyone to please pause for a moment of silence in memory of all the lives lost to overdose. Thank you. I'd like to recognize all of our distinguished guests, elected officials, community leaders, chamber presidents, all those who have taken the time to join us here today. We have members of the Islip Town Board, Councilman Jorge Guadron.
Thank you.
Councilman John Lorenzo. Councilman Mike McElway. Our receiver of taxes, Andy Whitman. And also members of the board who were not able to be here today, Councilman Jim O'Connor and our town clerk, Linda Vevrica, who have all been so supportive. We are so honored today to have our Suffolk County Executive, Ed Romaine, here. Also our New York State Assemblyman, Mike Durso. Our New York State Senator, Monica Martinez. And Megan O'Donnell, who is here representing our district attorney, Ray Tierney. Also, Suffolk County legislator, Steve Flatterin. I'd also like to recognize some of the other distinguished members of the community who have been so helpful. Heather Hugelmeyer, who is the Senior Director of Behavioral Health at Northwell South Oaks. Chris Rayo, who is the Chief of Emergency Medicine at Catholic Health and the Chair of Good Samaritan Hospital University Emergency Medicine. Kathy Konisdorf, the CEO of the Jake K Foundation. Someone who has been so instrumental in our task force and in this Islip Goes Purple initiative, and that's Mary Ann Pfeiffer, the Executive Director of Youth Enrichment Services. And showing the breadth of support that this initiative has had, people that have to deal with this issue, members of our Suffolk County Police Department, and representing President Lou Civillo of the PBA and all their members, we have CJ Hutter and Dave San Martino with us today. We have some of the chamber presidents who've joined us today who are getting the word out to the business community. The flags are up in the downtown areas. The purple bulbs will be lighting up all the lampposts. But Liz Mayotte from the Islip Chamber of Commerce. And from West Islip Chamber, Rich Carpenter. And certainly we are so blessed in the town of Islip to have two first-class hospitals, Good Samaritan Hospital and South Shore University Hospital. And I mentioned Chris Rayo earlier, who you'll be hearing from later, but also the head of community outreach and a million other things for Good Samaritan, Justin Jason. And from South Shore University Hospital, the face of the community, Angela Mandelos. The executive director, who's fairly new but not so new, and she's really thrown herself into the role, Irene Masick. And Michael Scarpelli, the executive director of South Oaks. And we know the schools have played a pivotal role. We have a lot of students here today, and these superintendents are showing their support and bringing the word back to their staff and their students about what this initiative is all about. And from Connecticut, the superintendent, Dr. Santamore, and the Director of Student Services, Joanne Pisani, also from Connecticut. And the East Islip School Superintendent, Dr. Paul Manzo. If I have missed anyone, I apologize. Just let me know, and we'll catch you later on. Today is a very significant and meaningful day for our community, for it marks the annual Islip Goes Purple kickoff event, where we turn our communities and our beautiful town hall cupola purple for the month of September for recovery and mental health awareness. Islip Goes Purple symbolizes our continued commitment to stand together, united in memory of the lives lost, those in recovery, those struggling, and the families throughout the town of Islip and across Long Island impacted by mental illness, struggling with mental health, and those affected by substance use disorder. And it does not discriminate. It can affect anyone, regardless of economic or social status. For the last 5 years, our community members, business owners, and community partners have been pivotal in the success of Islip Goes Purple, which in one way, we come together as a community, and this effort has grown throughout Nassau and Suffolk counties, with Brookhaven, Babylon, and Huntington townships following the town of Islip and lighting their communities purple, along with Massapequa Park in the town of Oyster Bay. Having elected officials join with us here today is testament to the fact that substance use disorder, mental illness, and caring for one's own mental health are issues at the forefront that we must address and that we are willing to tackle. These tragedies don't happen to other people, they happen to people like us. All of us have been touched in some way by loss due to overdose or suicide. We are making strides, but we have more work to do. That is why we continue our commitment to raise awareness of this dire issue. From the community level up to the town and state, we join together to go purple and stand united in this effort. The flags will be displayed here on Main Street and across school campuses. New York State will light landmarks purple across the state, and we're asking our local businesses and civic and community groups to help spread the word in displaying purple. Action has been taken to continue the conversation, to help educate our community and provide important resources. Our Town of Islip Opioid Task Force provides targeted Narcan distribution year-round. Harm reduction strategies are in place to detect harmful additives, preventing overdose deaths, and saving lives. The 9/11 Good Samaritan law allows 9/11 calls to be placed without fear of arrest in the event of drug or alcohol-related overdose. And Youth Enrichment Services Counseling Center, right here in the town of Islip and in Brentwood, provides support and referrals for treatment resources. Through these initiatives and continued community support and participation, we can make a united impact on substance use disorder, help save lives, and celebrate those who have made it to recovery. At this time, I'd like to introduce our first speaker, and that's our county executive, Suffolk County Executive Ed Romaine. Ed?
I'm going to be very short and sweet. IGP, Islip Goes Purple, to remind us that every life is important, that overdoses is something that we want to prevent, that we want to reach out to those and make sure that there is the counseling and the drug awareness training that is there. Islip is doing a great job. I know we have opioid money that is coming around, and Islip is going to benefit from that, which it did not to a great extent in the first two rounds.
We did not.
Neither did Brookhaven. But we are going to fund Islip because they are on the cutting edge of this issue. We want to help our neighbors and our friends. We want to make sure that there's less overdoses. We want to make sure that there's less addiction. God bless those who are involved in IGP, Islip Goes Purple. I'm wearing my purple badge. Thank you, Angie. Thank you, town board members, for your leadership. Thank you to the hospital for its leadership, and for our legislator, our deputy presiding officer, for his leadership. We need everyone in this battle if we are to win. God bless you. IGP. Islip Goes Purple.
You guys started early.
We started on time. Thank you, Ed. And thank you, Ed. Thank you, County Executive, for those kind words. Next, I'd like to bring up a woman who has really thrown her heart and soul into this initiative from day one. Whenever I reach out to her and ask for her help, she's always there. She's the Executive Director of Youth Enrichment Services. She plays a very, very crucial role in the success of Islip Goes Purple and is the co-chair of our Substance Abuse Task Force, Marianne Pfeiffer.
Thank you, Angie. I just think this is one of our most dire, important causes we can be here for: substance misuse, suicide, and mental health. I just want to thank the task force, Dr. Centimore, the Connecticut superintendent, my staff, who I make go on there so that they can actually do all the work. I see you, and I thank you all for everything you've done to do this. Mark Soda, Rhonda Netterman, Natalia Johnson, there are so many, to Herbie Medina. Different people who've come on, Kathy Konigsdorf, Beating Hearts, where is she, Karen? So many people, Carolyn Smith, there she is. We have a great article this weekend. Can we have a round of applause for Beating Hearts if you got to see that article? Amazing. And the hospitals who financially support this as well. Also to the county exec. Yes, we finally got opioid money here in Islip.
We're going to get it.
Well, we have some, but we need more.
And you're going to get it.
Because I was upset with round one.
As I was about round 1 and 2. Round 3 is coming up. New leadership with a focus on helping our towns, our villages, and our not-for-profits lead us out of the darkness.
Thank you so much for saying that. We have flags all over our school districts. A lot of the districts today are their first day, so I know these superintendents wanted to be here, but today's day one. And I just want to say we definitely want the county to go purple. Can we do that?
Absolutely. Brookhaven went purple when I was supervisor. I think the county will go purple, and we'll follow Islip's lead.
Awesome. Islip leads the way. I just want to very quickly say there's a calendar of events. It doesn't stop here. We have something on Saturday at Teatro in Bay Shore. We have Vibe and Thrive at our mental health clinic. We have the Long Island Ducks. I don't have the dates. The information is there because I'm all over the place. We have Healing Strides right over in our own town, East Islip Marina. There's a lot to be done. Come out to the Ducks game. We have jerseys to auction off. They will be wearing Islip Goes Purple on their jersey. It's an amazing partnership we have. We're so proud of all the work that the community comes out and does. Thank you.
Thank you so much, Marianne. And now, from Northwell South Oaks Hospital, Heather Hugelmeyer.
Good afternoon, everybody. Thank you so much for having us, and to be in an event like this and see the community come out is incredibly heartwarming. Last year, United States, over 100,000 Americans lost their lives to opioid overdoses. The shattered lives and families are our friends, our colleagues, our families, our community, and to come out and be in an event like this to honor that is incredible. I think it's really important that as I look out on this sea of purple, for us to remember that there are also more than 20 million Americans who are in recovery, and that is really a message of hope. And I would like that to be something that we take away from this event today. There is treatment that is available. Recovery is possible. People get well every single day. And all these wonderful community-based organizations that are here are part of that commitment. At South Oaks and throughout the Northwell Health System, we are committed to continue to improve access to care related to substance use disorders and mental health across the continuum of care. I hope that everybody can remember as you sit and think about approaching this from a standpoint of humanism, empathy, and compassion. And if we can continue to look at this issue through those lenses, it reduces stigma, but it also allows us to remember that we have the opportunity to provide hope and instill hope in people who are suffering from illnesses that are often very hopeless. So this type of opportunity and the community coming together, it's going to take all of us. No single one entity can solve this issue. We need to do it as a community together. And so an opportunity like this and this event is an amazing kickoff for that. So thank you, and it's terrific. Thank you so much.
Thank you, Heather. And next, I'd like to bring up the Chief of Emergency Medicine with Catholic Health and Good Samaritan University Hospital. Someone's on the front line when people get rushed to the ER, so he is seeing this all the time. Dr. Chris Rayo.
Thank you. So awareness is really step one for this issue. Emergency departments across the country serve as a safety net for healthcare and access to healthcare. And one of our slogans is 24/7, 365. And I don't think that slogan applies as much to any other healthcare issue as it does to this one. These are very complex patients and complex issues, and it's often multifactorial. There could be multiple medical issues going on, behavioral health issues, in addition to substance abuse. We are making strides. I think that that's pretty clear, but I can tell you that down the road at Good Sam, we're seeing 6 to 8 patients walk through the doors every single day with a primary diagnosis of substance abuse or overdose. That's 6 to 8 people every single day. And that's not counting the countless others who come in with another issue, either medical or behavioral health, also related to their substance abuse issues that they're having. We are very dedicated at Catholic Health and Good Sam, and we take a team-based approach in targeting this issue and this patient population. We have social work services available all day and a team in the emergency departments to help us with this issue. We have psychiatry services 24/7 with an in-house psychiatrist, as well as telepsychiatry services overnight. We have partnered with government for a Narcan distribution program where we will give people, either patients or relatives or friends, Narcan to administer if it's necessary outside of the hospital. Obviously, our emergency medicine team, we focus training on these issues. We've partnered with Family and Children's Association to develop a Sherpa program where we have peer navigators who will connect with the patients and or their families to help guide them to long-term recovery once they leave the emergency department. This issue is core to the mission of Catholic Health, to Good Sam, and I know to my team in the emergency department across the system, and we are committed, but we all have a lot more work to be done. Thank you.
Thank you so much, Dr. Rayo. Next, someone who's going to share their personal story, Madison from Outreach.
Hi, my name is Maddie. I'm 16 years old and I'm from Roseville, Queens, New York. Thank you. I've been at Outreach for 3 months and some change. I had to come to Outreach because I violated probation by smoking marijuana, disregarding the fact the judge could send me to jail. I was very careless. I was ordered to appear at the court and the judge was ready to send me to the JDC facility until she heard I had the opportunity to come to an inpatient rehab facility. I have since been sober for the full 3 months I've been here, and I haven't had a thought of relapse at all. I took the opportunity and came to Outreach to better myself mentally and physically in a sober state of mind. I've worked on myself a lot in a little bit of time. With no distractions around me, I've seen things about myself I've never seen before. Outreach has helped me finally be a kid again. I can live peacefully with myself. They helped me start doing the things I love, again, finally. I've reached my full potential. I still have work to do, but these things take time. After I graduate from the program, my plan is to finish high school and go to college to major in social work. I'm a kid in the system, and I know how it feels to have a social worker you don't connect with. I want to be the social worker that puts a smile on your face and brightens your day. I plan one day in the future I will be able to come back to OH2 and speak to the kids about my experience and open their eyes. Outreach is just a small period of your life, but you will get a lifetime of changes if you put your mind to it. Thank you.
Thank you so much. That was very, very brave of you. Thank you. Let's hear it from Madison. That was very brave. And I am certain, Madison, when you do reach your goal and you're that social worker, you're going to put a smile on so many faces. God bless you. Thank you. And now we're going to hear from someone who has been so active in the whole issue of awareness, and I can't thank her for enough for all she does, and that's Kathy Konisberg from the J.K. Foundation. Kathy?
I have to be able to say. Hi, my name is Kathy Koningsdorf. In 2013, I lost my 21-year-old son, Jake. At that time, discussions about addiction were often taboo or steeped in secrecy. On Monday night, this past Monday, I learned that another extended member of my family has lost his battle. He's from Long Island. While I don't have any details yet, I find myself wondering if he was hiding his struggles from his loved ones and his support network. He had a great network. In recovery, there's a phrase that resonates deeply. You are only as sick as your secrets. I believe this to be true, and we can rarely change what we do not acknowledge or discuss. As Paul Tournier wisely said, nothing makes us as lonely as our secrets. Secrets have no place in recovery. That's why I'm proud of the initiatives like Islip Goes Purple, which fosters community conversations about addiction and recovery. Recovery starts, builds, and maintains through dialogue, communication, and connection. And what a better time than in September, Recovery Month, to shed the secrets and start the healing. Let's keep talking and supporting each other. Thank you.
Thank you so much, Kathy. You know, she mentioned conversations, and I had a conversation earlier today, and looking back to initiatives that were in place years ago that were abandoned, and I'm hoping that we can bring back, and that's something like the DARE program, which encouraged conversations, and I'm going to be having those conversations, and hopefully we'll see that come back again. At this time, I'd like to ask everyone to gather around the switch so we can light the cupola purple, and I'd invite the town board members to come forward. And I want to thank them publicly for all of their support and dedication to all of our initiatives across the town, but especially this, and to recognize Councilman John Lorenzo, who serves as the liaison to the town board for the opioid task force. So thank you, John. And so everyone, are we ready?
Oh, yeah.
All hands on the switch. Are we ready?
Yes.
On the count of 1,
2.
2, 3.
Yes.
And it's purple. We may not see it, but it's purple.
2 more hours. By later. Trust us. Trust us. That's great.
And we have Tim Blackmore, who's from Queens, who's our first. Okay. And second place?
Michael Goods.
Michael Goods. And where are you from?
Fort Jeff.
Fort Jeff, Michael Goods. And our third place winner? Third place?
She's third place.
Who's third place? Alexandra Romas. Let's hear it for the winners. And let's hear it for everyone who participated, really. And to all of our elected officials that took the time to be here today, showing their support for this initiative. To, yes, everyone in the task force. God bless you all and thank you.